Welcome, everyone. We're going to give just a minute to allow for additional people to join us, and then we'll get started. Welcome, everyone. My name is Kelly Grant, and I'm the Corporate Director of Business Development and Case Management at Caron Treatment Centers. Thank you for joining us in our second webinar in this series. As a reminder, these series are being conducted via webinar format, and all participant microphones have been muted. Please feel free to ask questions using the Q&A feature, and if time permits, we will address these at the end. In response to these uncharted times, we wanted to share with you what we've been experiencing in the hopes that it's helpful to you and your clients. Today's topic is specific to older adults with substance use disorders and how this population has been impacted by COVID-19. Joining us today are Dr. Ming Wang and Sharon Matthew. Dr. Wang is an addiction medicine physician, and he's the medical director of the older adult program at Caron. Sharon Matthew is a licensed professional counselor, and she's the clinical director of our older adult program. We will begin with Dr. Wang, who will address concerns around COVID-19 in older adults with substance use disorders and how this population has been impacted. Next, we will hear from Sharon Matthew, who will explain how the milieu on Caron's older adult program has changed as a result of the virus. Following these presentations, we will address the questions that you submitted during registration, as well as any questions you asked during the Q&A feature. Based on the volume of questions that we receive, if we're not able to address all of these today, please know that someone from our team will follow up with you directly. Please join me in welcoming Dr. Wang and Sharon Matthew.
Thank you, Kelly.
Thank you. Good morning, everyone. I'm Dr. Wang. I'm the medical director of our older adult program here at Caron Treatment Centers. And I want to welcome everyone to this webinar. We are certainly at a very difficult time right now in this country, and at our facility here at Caron Treatment Center, no doubt we are feeling the strain of this pandemic as well. Given our population overall, we are taking precautions campus-wide. However, we do take care of a population here that are very vulnerable, especially to this pandemic with the COVID-19. Our older adult program here, we take care of some of the most frail patients here from a comorbid medical condition standpoint. And on top of that, there are overarching substance use disorder concerns that may render this population even more vulnerable to this pandemic and other complications that may result from not only this virus, but just the overall stress involved in this pandemic. We always knew that in this population of older adults, they come usually with more comorbid medical conditions such as heart disease, hypertension, COPD, diabetes. They also are a very frail population as well, given their age, the comorbid medical conditions, and they are certainly at a much, much higher risk for the COVID-19. Just from the medical standpoint and the standpoint of their deconditioned state, malnutrition, and frailty. Now, when we start to talk about substance use disorder in this population, which oftentimes could render them even more susceptible to medical illnesses and a viral pandemic such as this one. Our population majority has alcohol use disorder. That's the number one substance involved. Alcohol is also the number one substance involved in the older adult population in this country. followed closely by prescription opioids and then prescription sedative hypnotics. The alcohol use disorder have a tendency to render that person more immunocompromised than usual, not just from the complications as a result of using that substance, but also it impacts the person's mood as well. It causes depression, it causes anxiety, it causes sleeplessness. And today we have a better understanding of how even mood dysregulation can impact a person's immunity. And in this population, they are already isolated, and perhaps because of their substance use. And now with this pandemic, they're further isolated. They're not able to do some of the usual things that they might do. They have less contact with their families and loved ones. And just the depression itself has been shown in publications to cause reduction in their immunity. Now, add alcohol on top of that as a form of self-medication, then we're talking further increase in the risk for the COVID-19. Now, our older adults, they're already compromised, like I said earlier today, just from a medical standpoint. With substance use disorder on top of that, it oftentimes will exacerbate the underlying condition. The heart disease, the high blood pressure, the diabetes, the COPD tend to become exacerbated. And so they're already coming in with a baseline condition that's not particularly well managed. Maybe because their medications that they're taking already for those medical issues aren't working very well because they're drinking on top of these medications. Maybe they're just non-compliant taking their medications. Therefore, this is a spiral of their medical conditions downward. Now, we here at Caron Treatment Center, we recognize that in this very difficult time right now in this country, the resources for treating addiction is limited right now. And, but the substance use continues. People are not going to stop drinking, nor are they going to stop taking their addictive substances just because the pandemic is occurring right now. And oftentimes, our population are using the mood-altering substances as an unhealthy coping mechanism. And reaching a point where a sentinel event occurs, meaning that something bad happens. We just had one come in last night. A sentinel event happened, and the family, despite the pandemic that's happening all around us, couldn't do anything else but to get that person here to treatment before something else worse happens. And so we recognize the need for substance abuse treatment right now in this country. And fortunately here at Caron, we have the resources to make for a very stringent screening process and to have very tight medical and nursing oversight to ensure that everyone stays safe here, not only from a medical standpoint, but from a COVID-19 standpoint. And so we are still accepting older adults into this program, but with a very heavy oversight on screening and precautions. Not to say that we are not accepting anyone from the hotbeds in this country, but we are taking extreme precautions in making sure that those older adults who are coming from the hotspots are safe and healthy, and that our patients and our staffs are safe and healthy as well. And part of our ability to do that is we have a partnership with our Tower Health System, which is just down the road from here. That facility, they are taking care of COVID-19 patients. They have in place ability to monitor and to screen and to treat. And so we feel comfortable in that relationship with Tower Health so that in the event that our older adult needs that higher level of care because of COVID-19, then there's a readily available resource for us. Now, knowing that, especially at this time with a pandemic, we need to be especially vigilant, not only for our older adults and what's going on with them and potential presenting symptoms, but we're also very vigilant about what's going on with the staffs. Are the staffs okay? Are the staffs sick? And so with our older adult program, we already have 24 hours per day, 7 days a week nursing services here. I'm the medical director of this program here, and I see patients on a daily basis. The nursing staff and I are in constant contact regarding our patient on the unit right now of how they're doing from the usual medical standpoint, from a clinical standpoint, and now, more importantly, any potential symptoms that may indicate COVID-19. And so our oversight right now is tighter than it's ever been. And so we are comfortable in accepting older adult patients to our program because those strategies are in place here. Right now at our facility, COVID-19 testing per se with the instrumentations, we do not have that. We are looking to have on-site testing. However, we can test them here if we suspect or if we feel that one of our older adults needs to be isolated and tested. We do have the capacity to isolate them and to test them and send the samples out to our sister facility down the road here for on-site testing. And so the results do come back rather quickly. And so we do have that in place at this time.
That's great.
So, so hopefully that'll cover many of the questions that might be out there for you all. So I want to pass it on to Sharon Matthew now for her to talk about clinical aspects of our program.
Thank you, Doctor. That was great information. Just to say, when we started this program in February of 2015, we knew that older adults were coming into treatment, but we didn't have the capacity, especially if anybody's visited Caron, for the terrain to keep them pretty safe. So we developed a unit of 10 beds, 1 floor, right above the dining room. And yet it was a little problematic if someone's on a wheelchair, walker, that kind of thing. And we started with age group of 65 to 90. Well, pretty early on, we found out that that's not where we need to be. We lowered it to 55 to 90 because people are more compromised and coming in with complications, even at the age of 55. So what we did is accommodate that age group. And it came from a fact of them needing commonality, them being in the same sort of life events, that kind of thing, raising children, maybe having grandchildren, having worked, then retired. And what usually happens is people lose purpose of life, and then they cope with drinking or sedatives, that kind of thing. Also grief and loss, but it's not just the loss of a loved one, it's the loss of who they were as a person, their mobility. I identified as this person doing this work. We work with a lot of high-end professionals who had careers and lives that they threw their whole selves into, but now what am I and who am I? So that's basically from where we came. And then we were blessed in December of 2017 to move to this medical center. So older adults then moved to a 15-bed unit, having the whole second floor of the medical center. which is absolutely accommodating. Everything is ADA compliant. All rooms but one are single rooms. We call them suites because they're nicely large. All very accommodating to wheelchairs, walkers, mobility issues, railings in the hallways so they can hold on if they are off balance. And then we have one double room, which you're basically using for either maybe insurance contracts or when we treat couples, which we do treat couples and have done that successfully upon 3 occasions. So that's where it started. It came from a premise of knowing they needed dignity and respect. A lot of shame is attached to them at this stage of the game. Why am I not functioning? What do you mean I'm like falling all over the place? What do you mean I need care? And there's a lot of shame attached to that, thinking they had done something wrong or they were weak or that kind of thing. So we're trying to lower that. We're trying to educate about the disease of addiction, being non-denominational. Doesn't matter what age or gender you are. It just can hit at any time. So doesn't matter. Addictions can develop later on in life, and it's never too late to get sober is what I do believe, and so does my team. So that's sort of how it was set up. And now with what we're in, I'm watching this. I was off one week and how things changed in that week's time when I was at home. It was pretty dramatic because I felt it coming before I left. And we were already starting to stop the visiting, coming on to, well, it's across campus now, no visiting from family members, doing everything via phone. And now too, if someone's coming from a hot spot, then the families are waiting outside, doing the paperwork, sending it back in. So we already started to do those precautions even before I left. Our unit was, yes, then sequestered. So then we even went further and said, well, now we're not going to go to the gym because of treating them with a lot of precaution and safety. Lowering the foot traffic that comes onto the unit has also happened. So maintenance will come here to repair something, of course, but if it's not a really high threatening kind of thing, it'll be postponed a little bit. So it's all about safety and precaution. So admissions has done an excellent job of asking the questions, the COVID-19 questions of, have you been ill? Have you traveled? The woman that came in last night, same thing. So we felt comfortable bringing her in, and we are still taking precautions with her. Families are absolutely understanding and absolutely appreciative. And it's interesting, especially this population. I dealt with H1N1 years ago in 2010 when I ran the Women's Extended, and they got cabin fever. They were constantly complaining, we can't go out to meetings. That is not what I'm experiencing now, which is really nice to see. This population is actually grateful for all the precautions that we are taking. They are grateful that we have their care and concern first and foremost in our minds. They are appreciative. We are not having group sizes above 10. Right now, my census is up to 10. It was a little lower at 8. We have 10 right now. If it goes beyond that, then we're going to split into 2 smaller groups. What I've been doing to keep them, I call it entertained, not because they said they don't want things so repetitive. So I've been bringing in other disciplines from units here on Caron's campus. The breakthrough folks came yesterday and did a workshop with them, 1:30 to 3 o'clock. We're trying to be more creative. And that's what I'm finding with myself when I run a group. I did an experiential community meeting the other day. So it wasn't your same old, this is what's going on, these are the main concerns, this is the problem. I did it experientially. They respond well, this population, especially to experiential techniques. We are having them live stream chapel so that they don't have to go to the chapel. Reverend Jack has been good about now breaking it up into 2 chapel services so my people can live stream that at 10 o'clock in the morning. We are sort of thinking on our feet day by day. I do a check-in in the morning with the team. How are things going and what can we do today to enhance clinical services? And I know that that is happening. Personally, I've been involved in that as well. Nothing's changed as far as meals. They are still able to go to physical therapy on the 1st floor if that's warranted. There's a hydrotherapy tub here on the unit, so if someone has chronic pain or anxiety, withdrawal, that type of thing, they can use the hydrotherapy tub. Meals are still happening in the dining room because we space it out. There's only 4 populations that use that dining room, so they take turns and times of doing that. And I think what's changed is are they using paper? They're using paper and then plastic utensils. So that's the only thing that has changed there. We have aides attached to all new patients for either 3 to 5 days or as long as they're needed. So they are being screened as well. And the beauty of us coming into work is we all get our temperature taken every morning or whatever shift you're entering. And then the patients are getting their temperatures taken twice a day, and that's non-negotiable. As far as electronics, people sometimes think because they're an older adult, they aren't using electronics. That is absolutely not true. Most of them come with a smartphone. Some come with Kindles because they can read it better. Some do take the tablets that are offered to them. On the tablets, there are meditation techniques. There are exercises to do. There are worksheets to do. So treatment has not stopped. I think the staff is coming up with really creative ideas for them to do their treatment work. Some artwork is involved in that, some therapeutic techniques that way. As I said, the tablets do continue, and family members certainly like that. They too are guaranteed that treatment is going on as usual, and they're actually happy with what they're hearing. We're doing family calls once a week, as always. We are doing family sessions twice a month, as always. They just will not be in person. We are now, the family therapist is offering WebEx twice a month on a Monday. Families who can participate and should are on a WebEx for at least an hour and a half in the afternoon to educate them about not only the disease, but the safety precautions they can take, and answering their questions about next steps, because it appears now that is where the energy goes. Like, what's going to happen? And someone asked the question, are they staying longer? Yes, they are. They need it clinically, they need it. And then it is helping the family members. The one family member is trying to find assisted living. Well, you know, at this time, it's a little difficult. Some are accepting folks, but basically the family member has to drop them at the door and leave and send them inside. So one family member has extended the stay here. She needs it. Her memory has some issues. So we're doing that case-to-case basis. Some are going to sober living. That's a little tricky as well. Not every sober living is accepting, especially an older adult. And then some are. So we're finding what is the right fit. And we just, some guys discharging today for a very appropriate sober living as an older adult professional who's retired. And I know they can meet his needs. And right now when they go there, they're going to be sort of sequestered, I call it, until all those restrictions are lifted. So it really would be no different. As far as getting them busy here, we're also, the staff is taking them for a walk outside. They aren't mixing with other populations, so the staff is taking them for walks. As far as bringing services to them for trauma patients, my one therapist is trained, so she's meeting with them individually here. Instead of going to CBT, cognitive behavioral therapy group with a psychologist on the other units, the psychologist is delivering that right here. So it's very much handed to them, and they're very happy about that. They do not have a feeling of missing out. I can safely tell you that because I've been interacting with a lot of patients, especially this weekend at the end of last week. So I believe, if anything, I could safely say that the families are very happy for what we're doing. The patients are very happy for what we're doing and grateful. Interestingly, one of the questions was about alumni, and I'm going to answer that now because in the last week, what I've seen is alumni are calling in to check in, and they're mostly not because they're drinking, because they're grateful and they're doing well, telling us they're doing virtual therapy with their therapists at home. We're also getting family members. So this is the one that I found very interesting and so telling, that now the family members are home, and if their codependency, so to speak, is not in check, what they're doing is now they're focused really, really so much on that alumni who was with us, taking their inventory, wondering what they should be doing. So their codependency is kicking in as a direct result of them being working at home or at home, period. So I found that to be interesting in the last 2 weeks. We also have the alumni coordinator the director doing an awesome job of offering her staff to pick up any calls if we get swamped with them of who can we talk to, give us a name, and we'll follow up because they're in all regions. Just know older adults come from every area. I think the one who did not come in this past 2 weeks was someone who's in San Francisco because he wound up going to a hospital instead of coming here just because of his own physical issues as a direct result of his drinking. So I hope that answers even some of the questions that were given to us. I hope that gives you a view of, we are absolutely doing treatment. And I'm actually personally writing a list is how is this affecting me as a person and a clinician? How is this affecting treatment as usual? So I have a list going for myself of awarenesses I've had, because I think in the weeks ongoing, they were going to have many, many more awarenesses. So back to you, Kelly. Thank you.
Thank you so much. As a reminder to all of our participants, you can ask questions via the Q&A feature. It should be at the bottom of your screen. So at any point during the presentation, you can ask a question there. First, what we're going to do is go through all the questions that were submitted during the registration process. And then if time permits, we will start addressing the questions that come in live. Dr. Wang and Sharon, y'all addressed this to an extent, but the participants still want to know, are we limiting admissions to the older adult program specifically due to age or due to any high-risk concerns?
We're really not. What we're doing is screening. So I'll have Dr. talk to that. We are really thoroughly screening via phone, and then the doctors give their opinion, and then when the person gets here, then we go even deeper with that. So
yeah, right now during this pandemic, our screening process has changed quite a bit compared to our usual screening process for not just the older adult program, but for the general campus. Right now, at the time of admission, there are asked screening questions regarding exposure, contacts, geographic location, and things like that. We're also asking any caretakers, family members who they're with, whether those members have been exposed and such. And so those questions are global. We're not asking those just for the older adults. It's campus-wide. The older adults, however, I oftentimes receive information of the older adults' underlying medical condition. Most of the medical conditions that I'm presented with are fairly typical medical issues that we commonly see with a heart disease, high blood pressure, COPD, things of that nature, as well as chronic pain conditions. Most cases, we have the capacity to take care of them here. Those few occasions where I might determine that the patient needs a higher level of care, such as a hospital situation, would be severe complications of their substance use, whether it's alcohol or prescription medications. With alcohol, typically we're talking about a very progressed liver disease, alcoholic liver disease, to the point where our capacity is not enough. They must transition to a higher level of care at the hospital. Or if they're on prescription medications, they reach a point where the complications, or especially the withdrawal symptoms from those medications, are at a point where safety's at risk. At that point, I would transfer that person to the hospital setting for a high level of care. But here at our treatment facility, very rarely do I have to send our older adult patients to a higher level of care, because we do have that capacity to manage a considerable amount of consequences and complications of substance use.
Thank you. And we hear a lot, especially in the news, about the concerns around COVID-19 as it relates to older adults, not specifically older adults with substance use disorders, but just older adults in general. So what are the unique COVID-19 issues that are specific to older adults that don't seem to be impacting the younger demographic?
The older adults, we already know that in general, older adults tend to isolate more. And oftentimes they're by themselves, they're lonely, whether they're divorced or widowed, and they have grown children who have their own lives to live and their own family to take care of. So that older adult person is left by themselves. And oftentimes it's the loneliness, it's the boredom, it's the depression, for which they use the mood-altering substances as an unhealthy coping mechanism. And in any situation, we often encourage the families to remain in touch with their older adult loved ones, regardless of whether the pandemic is happening or not. But under this current situation right now where that isolation and loneliness may be further exacerbated because the family members are not visiting them, they cannot see their friends or go outside even to take a nice walk through the park, the loneliness and the isolation becomes even more pronounced. And this is a time, and the CDC warned us about this not too long ago, as far as how the COVID-19 would affect the older adult population in this country. There's further isolation, further loneliness, leading to depression. And even in the case of just mere depression, it has been shown to reduce immunity in the older adults. And now you have the population of the drinkers and the mood-altering substance users who are using these substances as a coping strategy, which further complicates the picture and raises the risk of them having that sentinel event occur that I talked about earlier, which will place them in a very risky situation.
I would like to say the one thing I see when they're compromised, it's from smoking. So we treat a bunch of people who have COPD as a direct result of their nicotine. We absolutely offer them nicotine replacement here. And I do believe that compromises their system severely, especially with the nature of this virus, how it works.
Right. And what the family members, the adult caretakers especially, could do during this difficult time is we have a physical separation in this country, but we don't have to have social separation. There's a huge difference. What the CDC is recommending now is physical separation, but right. we must encourage everyone who's out there who are older adults to encourage not having social distancing, because that could occur in many ways. Yeah. It could occur through electronic devices. Like Sharon says, these older adult population, just our experience, that they are surprisingly savvy with their electronics. Our population here at Caron, they are allowed their electronic devices at certain times, and you bet they use it. They use it very well. And I often encourage the family members to plan, to schedule, to give their older adults a routine, a set schedule. Perhaps the children, the grandchildren could reach out to them at the same time, same day, every week to maintain a schedule. In our experience, our population here in our program do very well with strict schedules, and to not only keep them busy, but because oftentimes some do have cognitive impairment, some memory issues. And so with this routine and schedule, they do much better than not having that schedule. And I just spoke with a family member just several days ago regarding this issue. I encourage him to provide his mother with a routine. Maybe allow the grandchildren to call at the same time every night, the same night of the week, and to reach out to them and teach her how to use electronic devices such as Zoom or Facebook. So there are many options out there right now to keep the older adult engaged and active.
And connected. It's the whole thing about connection. So when they come here, we teach them how to socialize again, because they've been so isolative, as he said, in their house. So.
Thank you for that. And Sharon, this question is for you. What do you say to families who are reluctant to send a loved one to treatment during this pandemic?
What I would say, but I haven't had to say this yet, they do ask, how are we going to treat them safely? So that starts with Megan's team, the admissions team, first. So they will explain, I think, what we're doing here and screen them and all of that. And then if a clinician needs to step in, then we have to tell them what we're doing as far as treatment, which is what I described earlier. We have to guarantee that they're not just going to come and hang out here and, just be safe and away from alcohol. So I think that's one of the points that we can get across. But it's all about the safety measures, the cleanliness. I mean, I'm telling you, the place is just so taken care of that it makes us all feel comfortable coming to work. The fact that staff is screened every day. So those are the kinds of selling points we have to say to them. Many actually, now that they're here, somebody asked about, is the length of stay longer? Yes. Many family members say, I'd rather have them with you than here at home.
And is that due to them not being exposed to the virus home where it is?
The virus and the alcohol or pills. It's the double whammy, right?
The families are very concerned about what's going on with their older adult loved one right now, because they can't see them, they can't check on them as frequently like they used to. And the lady who came in last night is a great example of that. And she's in her apartment, and she's drinking on a daily basis, morning into the night. And she ended up on the floor and could not get up. And that's the frightening part to the adult caretakers. What is happening to mom or dad? The time that I'm not with them and I can't see them, what's happening to them? Are they okay? Are they not able to get to the phone? And so that frightens the family members.
And
so,
then they call.
Right, and so that does not, the pandemic, we have not seen it as a deterrent to the adult caretakers bringing their older loved ones into treatment, because for them to continue drinking and falling or hurting themselves, that's right now, that's scarier to the family than the pandemic.
Thank you. And this next question, I think, is a great question that's specific to our industry as a whole, not just specific to the older adult unit at Caron. But how are we managing physical distancing while still trying to achieve the connection that's necessary to obtain amazing recovery that, as we all know as professionals in this industry, is a result of connection? So how are we managing to the physical distancing while still trying to achieve the connection?
So we're keeping that standard rule of standing so far apart or being apart in our offices. Luckily, our offices are big enough to do that. In group size, as I said, I make sure that there's enough space and that there should not be more than 10 there. But the other part is, like, they have a plan even for someone who's in isolation. What we've got to do is have the therapist call that person's cell phone. They can do the work over the phone until that person is out of isolation, so they don't feel alone. The only ones going into the room, of course, are the nursing staff and the doctors. So that makes them feel like they're not hiding out in in that kind of space. We are, as I said, bringing treatment to them. One of my therapists actually took their smartphones and downloaded apps to get into meetings on each of their cell phones. I thought that was thinking on your feet, out of the box. She did it. I love it. So I don't see that distancing. They, as I said, will say to us, we are really grateful for what you're doing for us, because they can see it.
And have they been resistant to distancing and self-quarantining?
No.
We are following the CDC guidelines of the physical separation, and we are, our medical team, our CMO and our medical director and the rest of us physicians here, we are following the CDC guidelines very closely, because it appears to be constantly changing right now. And so we do take heed to that. Yes. And we do not ignore the CDC guidelines, because right now that is the best tip of the spear for us right now. They are the guide, they are the authority right now. So we are following their guidelines with the physical distancing, with the precautionary measures and such.
And I think what happens is the admissions staff, again, is doing a great job of telling them that prior to the person coming in here. They're already giving those points of what we need to do to keep safe.
Thank you. And as we all know, older adults are just as susceptible to substance use disorders as any other age, if not more in some cases. Are you finding, though, that during this pandemic, is there use or abuse of alcohol or other mood-altering substances? Is that changing as a result of the pandemic? Are they using more? Are they using less? Is it the same? What have you seen thus far?
I think it's too soon to tell. I saw that question and I thought about, well, it's all like it's all of a sudden it's coming on. And I think the people that relapsed had already relapsed. I don't know, we can't measure that still of how much did this create. I read an article though last night across the board with addiction. They think, not older adults, but across the board, that it is fueling people to relapse as a direct result of not being able to go out, of being in their homes like he talked about. But those are the people who aren't connecting with meetings, online meetings through Zoom or whatever. So I think for us here, it's too soon to tell for me. As I said, I'm more thrilled with seeing people reaching out because they want to be connected to us because they felt like they had a good experience here and it's someone that they trust. So I want to measure it. I want to find out. I just know for me, it's too soon to know.
And I would imagine it's also too soon to tell this, but do either of y'all have a theory as to the specific older adult population whose use is increasing as a result of the pandemic? Is that due to fear or anxiety around them contracting the virus or their loved ones contracting it? Or do you find that it's going to be, or do you think, as I said, too soon to tell, but do you think it will be more about the isolation that's then triggering them to use more?
I think that's the piece that's going to fuel it, is they're not, like he talked about, Dr. Wang, not being connected or seeing their loved ones. They can't come to your door. You can't see your grandchildren. You can't see your great-grandchildren. I think if anything will fuel it, it is that, not necessarily the fear of having this illness. Most people, when they come to our door, it's a direct result of the leverage of the families. We love you, but we can't do this anymore, so you need to get help. It keeps them sober as well. So without that, why would I? I live alone. My husband passed away, you know, that kind of thing. So I think it is, again, the fear of not being connected to their loved ones. They really, really care what their loved ones think.
Yeah, I'm not sure that the deterrent is fear of contracting COVID-19, but what I am appreciating right now is that those of our patients who have left recently or are about to leave here in the near future, we are unable to provide them sort of a traditional foundation of recovery. I always tell people that foundation is so important. The sustainable abstinence has to be based on a foundation. And now many of the 12-step meetings, if not most of the 12-step meetings, such as AA meetings, are not occurring in real time, but in virtual time. It perhaps may be difficult for the older adults or the newcomers to establish that connection with others in the program, which is very, very crucial in recovery. Some people are taking our suggestions and doing virtual meetings, but many are not. And without that physical connection or that fellowship, my fear moving forward here in the next several weeks and month is that that they will slip through the cracks and not become engaged in a foundation of recovery.
Thank you. And who seems to be more concerned about the pandemic, the older adult patients themselves or their adult children?
The adult children are more worried about what's going to happen next. So they are safe here, but when they're coming to discharge, so several are okay with them staying a little bit longer till some plans can be really fine-tuned. Initially, what I saw was some patients thought they should leave early because they won't get out of here. That was the other way to look at it. Now I'm not hearing that from the patients. And they've been very cool and calm about being here. Always adult children, no matter if it was this time or not, they're always worried about what's next. If they're going home alone, is that going to be the trigger? A lot of education with adult children. We just did a call today with an adult child and we brought the psychologist in. It really alleviated some of her fears. And I think she's making a really solid plan for what's the next steps for mom. We do use, just so you know, that we do use a lot of recovery coaching for this population. Really works, where we'll latch someone onto them who can have an understanding of older adults and that type of thing. And then they will stay with them maybe a week or two, hot and heavy, and then sort of back off a little bit That's still going. And I think one thing that we're doing as well to help everyone is using My First Year of Recovery. Our older adults do sign up for it. And also it helps that one family member they choose who can stay connected via phone. It is a web platform, so there is no needing to go out and that kind of thing, and they can stay connected and they can chat. So we're finding that to be helpful as well.
And that's actually a great segue, Sharon, into this next question. This is specific for older adults in recovery who are not at Caron, who are not in treatment, but are at home. What are some online services that this population can utilize during this time to strengthen their recovery?
We have been suggesting chat rooms, and I think the doctor can speak to this as well. We are some don't like the 12-step recovery modality. So what we do today is introduce them to Smart Recovery, which I know that can go out and on a platform. So it is about staying connected. I am using, as I said, the alumni director is volunteering her staff, since many of them are working from home. They are calling them as well. So the phone is really a lifeline for some. They are absolutely allowed to call us, and we give everybody our numbers, and then they can call us just to check in. They can basically email us and say, hey, I was just wondering how you're doing. And I've had a lot of alumni, knowing that we're working here, saying, I hope you're doing well, which I think is interesting. And then what we'll do is call them back on the phone. Any other suggestions, Doctor?
Yeah, there are many platforms out there for recovery meetings. And we certainly do suggest highly that our patient population, when they leave to begin their recovery journey, explore 12-step programs, because it's very abundant. And technology such as the Zoom, kind of like what we're using now, is really accessible. It's not very hard to use at all. Perhaps the children or even the grandchildren, that's even better, could show their grandparents how to use the Zoom app and help them download it. There are at the very minimum, we could oftentimes provide 12-step contacts. Those people who are in recovery already in their region that we are aware of, we could hook them up with that person through the phone, and they could make contact with their 12-step recovery person to just stay in touch. And so those are just some of the ways that recovery community these days are staying in touch with each other and still having meetings.
And things such as also signing up in that for yoga. We had this one woman who loves to exercise when we couldn't take her to the gym. She then put an app on her phone so that she could do exercises right in her room that were approved. So I know somebody that's doing Zumba classes. Anything that movement oriented is really, really good.
Thank you. And now we're going to move into the live questions that came through using the Q&A feature for these last 10 minutes or so that we have together. So bear with me because technology is not my strong suit. So as I access these questions, this first one, Dr. Wang, is for you. If there isn't an underlying condition besides substance use disorder, is there still increased vulnerability to COVID-19 in this population?
Yes, there is. And the answer to that question is a strong yes. Given an older adult with comorbid medical conditions, without any substance use disorder on top of that, it still renders them very susceptible to the COVID-19. When we're talking about the most common illnesses that we're all very aware of, heart disease, high blood pressure, diabetes, COPD, all these major medical issues renders that person very susceptible to any overarching infection. You know, even speaking of a common cold or a superficial infection from a cut or a wound. And with COVID-19, this virus is rather unique in many aspects. Not only is it aggressive, it's rapidly transmitted, but also once the person is infected with COVID-19, it compromises their cardiac tissue. Even in someone who has no cardiac issue at all, or it compromises their pulmonary condition, even in a perfectly healthy person. So now we're talking about a population with underlying heart disease and underlying lung disease. If they were to contract COVID-19, it will exacerbate those conditions. So someone who's already have a low ejection fraction from the heart, their heart is not pumping at optimal capacity. With COVID-19, what potentially is happening is that it compromises that heart function even further. And so in other words, in the older adult population with underlying medical conditions, they are on a very steep side of the curve. So if they contract the COVID-19, they'll just fall right off that cliff. Unlike perhaps a younger, healthier person, which their curve is much more gradual, that you may take more time untreated before they would get in trouble.
Thank you. And what measures do y'all suggest that providers in the community, whether that be therapists, psychiatrists, primary care doctors, anyone in the community that may be seeing older adults for any reason that's not specific to substance use disorders, but what measures do you suggest that these providers use to screen for possible substance use disorders in this specific population?
I'm sorry, repeat that question again.
So that's okay. So whenever there's a provider who is seeing an older adult patient for something other than a substance use disorder, are there any, what was that, Sharon?
I was saying, how do they assess?
Right. Are there measures that they should be utilizing to screen for substance use disorders in this particular population?
Yes, there are many screening tools that primary care providers could use. And even in this population, it's a very, very fast screening tools that if you're all interested, you could find on the website, on the SAMHSA website, and ask a few simple questions, which would determine whether further exploration will be needed or not. And these have been utilized for many, many years now in the primary care doctor setting and the emergency department setting as well. Very quick couple of questions to determine whether there's no issue or further questions needed.
There's a Michigan screening for older adults. I know the SBIRT we use. So like he said, it's mostly on the SAMHSA website. So it's very good information.
Thank you. And a participant would like to know, are we requiring our older adults attend group if they are concerned about social distancing?
Here we invite them in to come in. So I don't force people. So I had a woman, and sometimes it's just resistance and I just don't feel up to it, or I hate the topic of the day, or whatever it might be. We do not force them. We highly encourage. And as I said, right now, I think they're very trusting of us that we're not going to put them in harm's way. So at this point, no one has refused to come to group because of that. And as I said, it's more of, you're going to talk about alcoholism today. I don't feel like listening to it. So there's some resistance that way. I think because of the precautions we've taken that they've seen, their resistance is not around that. But as I said, now with the group yesterday, that's as big as I want to go. It was 8 people plus 3 clinicians. That's it. That's all that group room can hold. So from there on, what we will do is separate them in 2. But then what I do, this is a population that loves to be informed. So you can't just surprise them with something. I love the fact that the doctors are talking to them twice a week on teleconference. So they are hearing it live from the Dr. Garbly and Dr. Drosnis twice a week about what the state of affairs here is at Caron, what we're doing to keep them safe. They really like that.
Thank you. And when we have an older adult patient discharging, what level of information are we requesting and are we releasing when their next level of care is a sober living or a recovery residence?
It is a case-to-case basis. It's based on clinically what's the best for them. As I said, the one gentleman did go to a sober living. He needed every minute of it, and it was because it's a safe one. So there's a lot of communication with the team about who, what, where, and why, and then finding that perfect fit. So there is just more difficulty now. The one we were going to use, they said we're not taking older adults, so we're seeing a little bit of that they are choosing not to take older adults, especially if it's in a hotspot area. I absolutely understand that. And then there's some that are open. It's just really, it's time consuming, but it's so very, very important to find the right fit. As I said, with one older adult, she absolutely, because of her memory, needs assisted living. The daughter is working with us. The son is working with us to find that, and they do the legwork for that with our support. So it's tedious and very worthwhile, and you just have to keep finding it. And then some will go home to doing, like I said, video conferencing with their therapist. And almost everybody that we've been talking to, that's how they're delivering treatment right now, rather than face-to-face.
Thank you.
What we do here at Caron is that when patients leave our older adult program, we do not just discharge them. There's always a plan, aftercare plan, next level of care plan, unless they refuse it. But most people will accept that. And so oftentimes is getting them into treatment and the treatment episode and then the aftercare episode. And we do not discharge people just because they completed the program here. We always plan for that next level of care, always.
And the families included in that.
Yes.
Thank you. And final question, to be respectful of time. What are your recommendations for families who are not sure whether their loved one has a substance use disorder or not?
They need to ask the questions. So oftentimes family members don't know how to ask the questions. So what I think they need to do is ask professionals. Dr. Wang and I do a lot of upfront calls of questioning, well, what about this? What about this? We'll give them our information on what we see with older adults. They take it. Doesn't mean they come here necessarily, but they appreciate the information. It might lead them. With this population, oftentimes an interventionist is used because they don't know how to ask the questions of their loved ones. Like, who am I to ask dad if he's drinking too much? He's the guy that raised me. So we give them that kind of additive help. But a lot of initial calls, whether it be to admissions or they'll call us and say, can you talk to this family? When we hear some of the things, we almost think, we also can do like assessments. If they're not quite sure, we can recommend through Megan's team in admissions to come in and do maybe a rapid assessment where we will know within 7 to 10 days, probably meet criteria for it. And sometimes that will get someone in the door where the patient would accept that, knowing that it's, well, I'm following your, you said I must do this, or you want me to do this, so I'll do this, and then I'll appease you that way. We still tell them at the end of that time whether it's time for inpatient or not, right?
Right, and identifying substance use disorder in the older adult population is rather challenging. This population is unique in a sense that they have so many comorbid medical conditions, and one of which is cognitive impairment and frailty and susceptibility to falls. All those things can mimic someone who's actively using a mood-altering substance. So identifying that older adult with substance use disorder sometimes could be challenging for us, certainly is challenging for the family. And this is what I always tell the adult family members, is that do not let the amount, the frequency of their substance use, for example, alcohol, fool you into thinking that substance is not a problem. Because again, we have to understand the physiology of the older adults. And here at Caron, we do understand that in older adults, because of natural physiologic changes in that body, even small amount of mood-altering agents could render that person essentially incapacitated. It could alter them in a very dramatic way. So perhaps 10, 15 years ago, 1 or 2 glasses of wine in the evening with dinner seems okay and is rather enjoyable. But 15, 20 years later, that same 1 to 2 glasses of wine, it causes a completely different picture. And so I always tell people to consider more of what's going on in their life. Are they not able to enjoy life anymore? Are they placing themselves in hazardous situation? Is it affecting other family members, even with that 1 or 2 glasses of wine? And if the answer is yes, then that may maybe further exploration is needed.
Thank you. That's helpful information. And Dr. Wang and Sharon, thank y'all so much for your time today. I personally know how busy you are, even when there's not a pandemic going on. So I really appreciate y'all taking the time to be with us during this time. And I also want to thank all of our participants for joining us today. We know you're also incredibly busy and just trying to get as much information as possible. When we know better, we all do better. So appreciate y'all joining us. And I would encourage you to be in touch with your local regional resource directors if you have any additional questions. As I mentioned earlier, we weren't able to get to all the questions today due to time constraints. So please know that someone from our team will follow up with you, and you're always welcome to reach out to us as well. I would also encourage everyone to join us next Tuesday, same time, same place, where we will be speaking with our admissions team directly to talk more specifically about how we have changed the admissions process, the screening, what we're looking for, and how we are being as diligent as possible as it relates to being in the midst of a pandemic and still doing our best to help more people achieve recovery for life. So thank you so much to everyone, and we look forward to seeing you next week. Take care.
Thank you, Kelly, for setting it up.
Thank you.
Thank you. Bye.
Have a good day. Hey, doctor.